morning, everyone. Well, it's morning in Dallas, Texas. For others, it's the PM. But I want to thank you all for joining us again, the Urban Search Institute, as we are hosting our second installment of our UNT Dallas Topical Issues series, where today we're discussing big data, artificial intelligence, and robotics, the challenges and opportunities. Today, we have our esteemed guest again for round two for a discussion that is very necessary, not only in today's environment, as we are being more, this is the golden age of technology, but also applying a lot of these tools to assist specifically communities who've been a part of who's been underutilized. And so how the impact of artificial intelligence, robotics, or just technology in general can impact our communities. My name is Matt Houston. I am lecturer of business management here at the University of North Texas at Dallas. I'm also a community advocate. I'm focusing on economic development, leadership, and education. And I am honored to not only be on faculty of the university, but I'm honored to be a member of the North Texas region, serving organizations like the Dallas Black Chamber of Commerce, in which I serve on the board of directors. We have several organizations who are working with us to make this happen that I would like to acknowledge. First, I want to thank the University of North Texas at Dallas, President Bob Mung and his team for providing the avenue where we're not only educating our 4,000 plus students on campus, but we're providing programs so that we can inform the Dallas community and abroad on issues, not only in higher education, but how we can apply that to better our communities. Secondly, I would like to thank our community organization, our community advocacy organizations. The Greater Dallas Hispanic Chamber of Commerce is here with us. You will hear from a representative there shortly. The Dallas Black Chamber of Commerce, as well as career services at UNT Dallas. You don't see him, but the guy who was making all of the things happen technologically is Mr. Arthur Lumsey, who is the director of the Career Services Department, investing in the lives of our students here. Thank you all very much for all of your work. Now, I would like to pass the microphone to Gabriela Carvalho, who is the representative of not only the Greater Dallas Hispanic Chamber of Commerce, but another community advocate whom I've known for a while, and how she builds her economic ecosystem. Gabriela, thank you for joining us.
Thank you, Matthew. A pleasure, likewise. I've known you for it feels like forever now, right? So thank you for your kind remarks. My name is Gabriela Carvalho. I am the Vice President for Economic Development for the Greater Dallas Hispanic Chamber of Commerce, and I'm here to do the opening remarks. And with that, I want to say that the Greater Dallas Hispanic Chamber of Commerce is proud to be ongoing partner of the Search Institute. The Search Institute focuses on equity for Southern Dallas neighborhoods through many initiatives. Today's webinar, focusing on what and why of artificial intelligence, is a vivid demonstration of the Institute's equity initiatives. The field of artificial intelligence is growing exponentially and has major impact in just about every segment of today's society. Today's webinar raises awareness of AI's impact and the need for effective policy responses so that the communities of color are front of mind when policy is being set. The Chamber commends the Search Institute for raising awareness and equipping leaders to advocate for equitable inclusion in this area. Thank you.
Thank you very much for not only those words, but the actions that you make in our community. So thank you for that, and thank you for your participation in this program. Next, I have the honor to introduce to you all again our MC, our Mistress of Ceremonies, or our EMECEE as well, Ms. Veronica Torres Hazley. Veronica Torres Hazley is CEO of Torres Hazley Enterprise, a collective bringing community and well-being to life. Her portfolio includes V12 Yoga Studio, Workplace Fit Co, and self-care brand Latina, a healthy Latina lifestyle. Veronica has expanded her reach with her consultant practice that ties her last 25 years of experience in several capacities that include community development, customer service, content curation, and calls marketing, and wellness. So the person who's going to navigate this discussion, you've heard her last week. She's not only well qualified, but well versed, and she's my sister from another mother, Veronica Torres Hazley. Thank you again, and we look forward to you directing our conversation.
Thank you, Matt. What an awesome seminar we had last week, and I'm so excited to lead it again. I learned so much, and I can't wait to share even more details of what we're going to talk about with AI. So without further ado, I'm going to introduce our distinguished speakers. If I may, I'm going to start with our lady first. We have with us Dr. Somba Musata, who is the Assistant Professor of Political Science at James Madison University. Dr. Musata received her PhD in Public Policy and Administration from Virginia Commonwealth University. Her research focuses on public financial management and economic development. She has a vast international development experience, having worked as country director in Zambia for Dicona, a Sweden headquarter international nonprofit. She is a multidisciplinary expert, is trained accountant, fellow of the Association of Chartered Certified Accountants, and also has a master's of business administration with specialization in strategy. Some of her research is published in the Journal of Public Budgeting and Financial Management and the Journal of African Business. Welcome, Dr. Musata. With us today, we also have Dr. Harvey White, who is an affiliate professor of the Biden School of the University of Delaware and professor emeritus at the University of Pittsburgh. Dr. White is an affiliated professor with experience in nonprofit and community leadership, as well as organizational management and performance evaluation. He was the founder of the Gulf Coast Center for Healthy Communities and an outstanding professor and thought leader on health policy, health inequities, healthy and active communities, and public health. He was also the past president of COMPA and ASPA and has duly been recognized with multiple awards at various levels for his distinguished and exemplary leadership and public service. Thank you both for joining us. I'm excited to dive in, and I'll turn it over to you, Dr. White, to continue our presentation.
Wonderful. I'm going to share my screen. Hopefully it'll work out this time. Can you see my screen? Okay. Hello?
Yes, we see that. Thank you.
Okay. So I'm going to put this on. So Dr. Musata is going to begin our presentation today. She's going to actually give us a recap from last week. I'm sorry, it's at the end, not the beginning. She's going to give us a recap from last week and have a few more introductory remarks, and then she'll come back in the end and talk about some policy areas. So Dr. Musata, it's yours, please.
Thank you so much, Dr. White. So I will go. Okay, I will go ahead and share my screen to just have a quick recap of what we looked at last week. So we started off this conversation by defining key terms on what they mean, and also the big takeaway messages that we had from our conversation last week were that when we talk about artificial intelligence, big data, and robotics, we talk about people. Our focus is really on the people. Our message is not against these technologies. We're so happy and excited that we're having all these technological advancements. But whilst we have that excitement, we recognize the importance of these systems and advocate for spaces like the one that we have been accorded by the University of North Texas, which we're really grateful for. We advocate for spaces like this where we can have conversations that center on the impacts of big data, AI, and robotics on people, especially those in minority groups. How do these technologies impact them today, tomorrow, as they function? Do these technologies make them better off, or do these technologies perpetuate the inequality that has existed in the past? From our conversation last week, we also learned that AI is ever evolving, big data is ever evolving, and robotics. So we can give definitions to a few terms here, but terminology keeps changing because these developments are ever changing. New terms are going to be invented soon. So each one of us needs to be on the learning curve, constantly on the learning curve, learning and unlearning and learning new things. We also talked about the fact that artificial intelligence, big data, and robotics are going to liberate us, but then they're also going to burden us. For example, a number of individuals are going to, their skills are not, their skills and contribution to the workforce is going to be taken over by robots, which have a greater efficiency when it comes to performing some of those tasks. So when that happens, what are we going to do with the excess human capacity that was deployed by those individuals? And thinking about that, are we training individuals for the future workforce? Are our policies aligned or up to date, or trailing many miles behind developments in artificial intelligence? We also talked about the risks of perpetuating inequality as a result of using big data, AI, and robotics. And we talked about marginalized communities being at greater risk of exclusion as we undergo all these developments. So today, Dr. White is going to go in and give us a bit more details, looking at specifically what that inequality looks like. And then later on, I'm going to address issues around the challenges and the policy landscape. And hopefully we will have a conversation together to look at what opportunities we have in this space. So I'm very happy and excited now to let Dr. White come and continue with our conversation.
Wonderful. Hi, can you see my screen yet? I guess
No, not yet.
I don't see screen share, Dr. J. How do I get screen share?
Okay, then let me pull it up at my end.
Okay.
Yeah.
Okay, I see option for screen share now.
Oh, okay.
It just popped up.
Okay. Now let me stop.
Stop sharing. I guess the answer is no. Can you see my screen now? Okay, it did. Okay.
Okay, let me do it for you. Yeah.
Well, it's saying, do you want to screen stop? And I say no. And then it disappears.
Yeah.
We would have this problem this morning, wouldn't we?
Yeah. Dr. White, you can go ahead. Okay. Let's see.
It says you're screen sharing, but I'm not sure what you see.
I see it. I see your screen, sir.
You do? Okay, good.
Yes, sir.
So let's get started. Thank you, Dr. Mazzata. Thank you, Veronica and Gabriel and others. We're excited to have this discussion today. As Dr. Mazzata pointed out, the last time we talked about the prevalence of of artificial intelligence, big data, robotics, and we went through a lot of examples of that. Today, we want to try and show somewhat of a human side for that. As I think, I know, as Dr. Mazzotta has emphasized, we're excited about artificial intelligence and technology and robotics. We're excited about what it's going to do to help liberate human beings and help us to be more effective and efficient, make the workplace safer. So we actually bring to bear a very positive attitude about it. One of the things that we also, as academics, always say when it comes to technology and tools is that no tool is an end within itself. We have to, in fact, make it relevant and make it serve our needs. And that applies to not only robotics and artificial intelligence, but every new intervention that we have to make sure that it's not an end within itself. Let's not glorify it and say, hey, this is wonderful. It may be wonderful for some and not others. And I think that's what we'll find about this issue of robotics. So today we're going to talk a bit about that. As I think I heard, I know I heard Dr. Gabriel say that IA is happening at a very rapid rate. And that's something that we're going to emphasize today. Our purpose is to, again, to illustrate its impact on people, some of the jobs, and then have hopefully an intelligent discussion about perhaps policy options. I put this, I hope you can see this okay. This is a graphic that I pulled off the web. And I put it here as we start this discussion about artificial intelligence part 2, because I think it demonstrates something that I think we need to be aware of. One of the things that we emphasized last week is that, and I heard Dr. Mazzotta say that again this morning, that machines can be more effective and more efficient than humans. What we're finding now is that robotics and artificial intelligence are in direct competition with humans for jobs. And that's something that we need to be aware of, that we are programming robotics to do things, and we'll illustrate a little bit of that today, to do things that humans used to only do. Now, machines have always helped make jobs easier for us, but we've not in the past seen machines eliminate so many jobs that humans would do. And that's what we're experiencing right now, and we have to prepare for that. So I wanted this to stay here. One other thing about this graphic is, and I don't think the artist did this by happenstance, he has the 2 robots at the front of the line, which suggests then that they are going to be able to be the first to be considered for this job and more likely to get the job because they can do the job more effectively and more efficiently and economically than humans can. This is another graph I pulled from the website. And I find this one very interesting. And I spent some time trying to count. These are jobs supposedly that are going to be affected or eliminated by AI. And I went through and just tried to count all the jobs up here. And I actually tried to decide if there are some jobs or some areas of the economy that are not going to be affected. And I could not find one. Almost every area that I can think of is going to be affected by AI, from nursing to finance, to bookkeeping, to accounting, to law, to psychology, to customer services, to pharmacy. All of these are listed up here. I was surprised when I saw this, and this is from an article talking about just how profound the effect is going to be on the workplace in terms of AR. And again, if you look at this, construction, engineering, call services, payroll, software engineering in and of itself, AI is going to be doing that. So dental services, all of these things are forecast to be affected, in many instances, be taken over by artificial intelligence. So I wanted to share that because I found this slide amazing in terms of the number of jobs they say are going to be affected by AI. And that leads to the conclusion about AI. The entire social economic system is in a phase of accelerating transformation. Markets are being transformed, business is being transformed, education is being transformed, government is being transformed, social welfare is being transformed, employment models are being transformed, and will be severely impacted by artificial intelligence. So everything we can think of in our lives almost, even how we play, that's going to be taken over. I even have seen some things about how we sleep in terms of the artificial intelligence that would have an impact on the bed, the breathing machines that we use. So every aspect of our lives is forecast to be impacted by artificial intelligence. Now, that's the impact on us as consumers. we'll get a little bit later to try and look specifically about the employment aspect, but I wanted to share this with us first. The conclusion, and Dr. Mazzata mentioned this a little bit, jobs that are going to be affected by AI and can be forecast in many instances be taken over by AI are tasks that are monotonous. They can be automated and gradually made the role obsolete for human beings. Tasks and activities that are related to call centers, document classification, discovery, retrieval, content, moderation, and more can be taken over by technology and automation. That means less work for humans. And then related operations, production, anything that can be systematized can be taken over by machines and done better. And that last statement on this slide is human beings are being replaced by smart robots that can safely navigate space, find and move objects, produce parts or tools, or perform complex assembly operations. So that's happening, and there's very little at this point we can do about it. The question is, how can we address it in terms of the impact on human beings and the welfare of human beings? And the question I raised after reading through the data on artificial intelligence was, should workers be concerned? And then I found this 2017 research report, which says not only should workers be concerned, but workers are already concerned. According to the Pew Research Center, 72% of people in the workplace in America are worried about a future in which robots and computers are going to be doing many of the jobs they're currently doing today. So people who are in the workplace today are experiencing the automation, artificial intelligence, and they're concerned. What is going to happen in my job? I can go back and think when I first started working, and again, I'm telling my age, every professor had a secretary. That's very rare these days because we have computers that do all of our word search. They do our editing for us. We don't need the jobs that a secretary used to do in the past. So I talk about that to say that was only the beginning. As we automate more and more aspects of the workplace, there are going to be more and more human beings replaced. Some studies predict that as many as 50% or as much as 50% of all workers are at risk of losing their jobs to automation. When we think about that 50%, that's half of the people in the workplace could be replaced by automation, according to some studies. These are areas that have been identified. Forbes lists 15 areas that are going to be affected in the immediate future: insurance underwriting, warehouse and manufacturing jobs, customer service, research and data entry, long-haul trucking, accountants, paralegals, radiologists. And then there's that last point down here that talks about any task that can be learned. I don't know what that really means, but that frightens me because I can't imagine any task that can't be learned. If this were true and if Forbes is correct, almost everything that we can learn can be automated. And they're suggesting then that there's almost nothing that in the future we can't program machines or systems to do that we're doing today. Impact on jobs, negative and positive. We always like to point out, though, that all is not gloom and doom. Since 2000, robots and automation have slowly phased out 1.7 million jobs. On the other hand, on the flip side, it is predicted that AI will create 97 million new jobs by 1925. Studies both in the US and UK suggest that AI will create more jobs than is in fact eliminating. So it's not doom and gloom. The question, and Dr. Mercado mentioned this before, the question is, are we training workers for these jobs? And I think that's something that we should talk about perhaps as a policy option. What are we doing to prepare people for those jobs that are going to be created? Because there will be jobs created, but are we going to have the people in the workforce to in fact take those jobs and be prepared for those jobs? In areas of critical labor shortages. Another area, and while we can be concerned about it, there are some areas right now that we are having some critical labor shortages, and we just don't have the workers for a variety of reasons. I'll talk about one of those in a minute. The one that's most prominent right now, if you watch TV at all, every trucking company is advertising, come work for us. and talking about the benefits of driving for that particular company. Trucking right now is having a critical shortage of driving, and AI offers hope for this industry. Education, we have a shortage of teachers in the classroom today. So again, we're looking at ways how IA can assist us in education. Healthcare, there's a critical shortage of nursing globally. I was involved in a discussion a couple of years ago about how right now nurses that are trained in the Commonwealth of Great Britain are now being recruited to England. For Ghana in particular, if you have a nursing degree, you live in Ghana, you're automatically given certification in England. That's happening right now because we have a critical global shortage of people in the nursing industry, and healthcare in general, there's a shortage. And then information technology. One of the things we talk about on the HR side, on the talent management side, is that while we have plenty of labor, we have a critical shortage of qualitative and unique talent that's needed to drive this new information age. That we say that we don't have a shortage of workers, but we have a shortage of talent that's appropriate for today's workplace. So again, we've got to make sure we train people in the areas where the needs are. And again, this is at the bottom, it says that there's 51,000 truck jobs available today. This is in the US alone. And this has gone up every year since this was mentioned in 2017. We showed this slide last week, and I wanted to show it again because I just mentioned that nursing is one of the areas that's going to be, or that is right now experiencing a critical shortage. And a response to that has been artificial intelligently driven robots who can do most of the things, probably about 85% of the things that nurses can do, these robots can do. They can take your temperature, they can bring you food, they can bring medicine to you. So again, these are nursing robots that are in use right now in Rwanda. I mentioned last week in the discussion that also in Mexico, they're using robotics to actually measure the temperature of people when they come into the hospital. So robotics are now doing some of the things already in the healthcare industry, not because they do not want to hire people, because if you're in the nursing or healthcare field right now, it's pretty easy to get a job. It's because there's a critical shortage of people in those areas right now, trained in those areas. And the sectors, again, I've mentioned this in passing, that this is just a greater emphasis on it. Transportation, economic commerce, and financial services are the ones. And again, this is an explanation. Transportation is being transformed. It's going to be fully autonomous. We had a discussion on transportation, another organization I'm part of, and it was pointed out that in the very near future, and plans are being made as we speak right now, for trucks to drive coast to coast without a driver. That they'll get on the interstate in Delaware, drive to California, and then someone will meet them at the interstate and then do the local driving by a driver. That this is being planned to take place within the next 2 to 3 years, coast to coast driving with autonomous driven trucks. Professional drivers, taxis, we said trucks and more. Right now, every major automobile manufacturer in the world is designing autonomously driven automobiles. If you were to go to New York or DC and look at who the drivers are, they're usually minority drivers or underserved, underrepresented populations driving those taxis. And so those individuals are going to be affected. We'll come back to that in a few minutes. Again, going back to trucking, I mentioned the 51,000 that are needed. And then here I note some reasons why. Regulations are very strict now. Drivers can only drive 8 hours and must stop. And baby boomers are retiring. And the new millennial population is just not excited about driving a truck across country. So it's hard to recruit people into that transportation industry. So automation, artificial intelligence is going to step in and fill the void in that area. Again, this is a truck that's under production as we speak right now. I pulled this from the internet. They talked about the number of trucks they plan to produce in the next few years. These trucks, again, will be driven coast to coast autonomously without a driver. They'll be monitored electronically, but virtually, but there would not be a driver. They will be driven by automation from coast to coast on the interstate. This is a commercial example of what's going to happen. Right now, Amazon is begging people to come to work in terms of electronic commerce. The problem is they don't have the workers to actually do the work in Amazon. And what's going to happen and what is happening is that the complete process from receiving an order, putting an address on that, shipping that, and delivering that to a customer will in fact be automated, and in fact is being experimented as we speak right now. Drones delivering packages from the factory, robots actually putting those packages together and then putting them in a drone, and those are being flown to neighborhoods right now. That's under experimentation. So electronic commerce is going to happen, or is in the process of happening right now, because this is an area where there's just not enough people who want to work in this kind of industry full time. It's a very strenuous activity. It's very monotonous. The hours are usually from 9 o'clock at night until 7 o'clock in the morning. Very few people would like to work in that area. Robots do not have a problem working those hours. So we're going to have robots working in that industry, or we do have robots working, and that's going to be accelerated in the very near future. Financial services as well, underwriting insurance. Why this is taking place? Because computers and artificial intelligence can do assessment much faster than human beings can. They can pull up the data, look at a neighborhood, look at a person driving record, and come up with a policy and a premium and a cost in a matter of seconds, whereas human beings can't do that. So data collection is another area. When we talk about research, how data is collected, how it's organized, analyzed, and presented can be done much better by artificial intelligence than human beings. And it can be done more accurately, and in fact, then enhance decision-making by making them quicker and more cost-effective. So now I want to spend a few minutes, if I can, just talking about the impact on jobs in the US. 47% of current US jobs are at risk from AI automation. This is a study from 2013. It is estimated that AI automation would displace 400 million to 800 million individuals around the world by 2030. Again, this is 2017. It says, on the other hand, it is suggested only 14% of jobs will be lost. Now, I emphasize here and I highlight in red that even if only 32% of jobs or 14% are lost, 70%, up to 70% of everybody's job in the workplace today is going to be significantly affected by automation. So even if your job isn't lost, your job will be affected by automation. We're going to have to keep learning and growing ourselves, but on the other hand, automation is going to take over part of what we do. And that's perhaps a good thing. I'm not suggesting that's a bad thing. Here again, it is a description of jobs that will be taken over, those that are repetitive and labor intensive. AI is forecast by scholars to create more jobs than eliminate. So it's not a matter of people not having jobs not being available, it's not having the right people for those jobs. So the concern isn't that there won't be jobs. There will be job loss. The concern is twofold. One is the jobs that are going to be lost is going to have a disparate impact, and the jobs available, people from underserved communities will not have the skills to take those jobs. What I have here is working categories for the U.S. Department of Labor. And I'll summarize this and not take too long, but what this table shows is where we have concentration of minorities, particularly Hispanics and African Americans. If you look at these tables, if you can see them, the second and third column is Blacks and Hispanics. In the managerial professional area, we're at the bottom, Hispanics at the very bottom. If you move on to natural resources, we have more Hispanics working in natural resources, lawn services, and other things that relate to nature that require manual work. More Hispanics involved in that than any category. If you look at production and factory production and transportation, again, you have a large concentration of Hispanics and minorities in those two areas. You move over to sales, it's not overly represented, but again, here you have a significant concentration of Hispanics and African Americans. In fact, African Americans are more highly represented than anybody else. Hispanics or third or second, or actually third in terms of the category, just a little below white, but again, a very significant concentration in sales. And then if you look at services, you'll see that African Americans and Hispanics are overly represented in services. And why do I put this slide up? Because the areas where this table from the Department of Agriculture suggests that African Americans and Hispanics are most heavily represented, those are areas that are going to be most heavily impacted by AI and robotics and automation. And so that's why this table is shared with you. So let's look at some specifics here. According to the U.S. Department of Labor, African Americans and Hispanics have a proportionally high participation in occupations related to production, transportation and moving, sales and office and services. Again, that's what the table showed a few minutes ago. These occupations are areas where jobs are expected to be affected most significantly by artificial intelligence driven automation. So again, the jobs where we find the highest concentration of African American and Hispanics are the ones that are going to be most significantly affected by automation and artificial intelligence. So again, flags ought to go up for us. Does that mean we're going to lose jobs tomorrow? No, but it means that as we have this rapid increase of application of artificial intelligence and automation to jobs, those that are going to be put out of work the fastest are going to be, at this point, African Americans and Hispanics. And if we were to look on the education side, these are the areas where we find African Americans and education and educationally least represented in the high-tech jobs of the future. So that becomes a policy discussion for us for the future. More than half of African Americans and nearly 2/3 of Hispanics, 61%, work in two occupation groups, service and sales and offices. Again, more than half of Hispanics in America are in those highly susceptible occupations for automation and artificial intelligence. In contrast, only 49% of whites and 34% of Asians are in these categories. So again, African American and Hispanics are in those high category areas that are expected to be impacted most significantly by automation and artificial intelligence. This high concentration into these two groups make Hispanics and African Americans more susceptible to projected job losses from automation. Equally hard hit will be the low skills or workers in restaurants and bars. I showed last week an artificial intelligence driven bartender that can replace up to 10 bartenders. So again, areas where we find African Americans in high concentration are going to be impacted the most by artificial intelligence and automation. Again, this at the bottom, that bottom statement there, this includes jobs for parkers or valets, people who are doormen, greeters, checkers, coat hangers, seaters, bartenders, managers, entertainers, cleaners, and cashiers. These, again, areas are going to be affected, the service areas where we have a high concentration of Hispanics and African Americans. The biggest negative impact of robots will be on the young, less educated Black and Hispanic men and women, groups that already have low wages and employment rates that are higher than average. Now, we can point out that the economic recovery, particularly associated with COVID, has masked the impact of robotics on employment. But as soon as we get out of this pandemic, there's expected to be an acceleration. And in fact, one of the discussions that can be related back to last week, we see in China a very rapid application of robotics. One of the arguments is that if we were to have another crisis like we've had these last 3 years, and if we have robotics working, we won't have to stop production because robots will be able to do the work and not exposed to a threat of these viruses. Now, there are some jobs, and we can talk about these. We mentioned social work, writing, defense lawyers, and IH training that may be a little bit immune, but even those are not completely immune from artificial intelligence. Again, artificial intelligence may have less of an effect in these fields, but they will have an impact as well. So some concluding observations. On the positive side, robots can clean nuclear facilities. They can assist firefighters in locating, and they can locate problems in a sewer system. There are all kinds of things that human beings do not want to do that we can train robots to do. That's the positive side. On the other side, what we've seen is that since 2009, the number of robots per 100,000 per 1,000 workers has more than doubled. That's expected to double again in the next 10 years. So we cannot expect that the pandemic impact in terms of minimizing the effect of artificial intelligence and robotics is going to continue. Every projection that we've seen suggests that there's going to be a rapidly increasing application of robotics and artificial intelligence. The one area that we have not, that has been the least affected, are the unionized states. They have lower robotics than other states. We think that may be because labor contracts are written for an extended period of time. What will likely happen when those contracts end, there'll be serious negotiation about the use of technology and the elimination of jobs when that happens. And I've listed here a simply summary, Dr. Mazzotta, I don't want to discuss anything that you're going to discuss, but I've simply listed some areas here that I think should be considered. And I'll let you lead this discussion, Dr. Mazzotta. But what I wanted to say before we talk about the job aspects, last week we talked about the data aspect. And one of the things that we need to make sure, and this relates to both training and it also relates to job impact, and in some instances, even health impact and financial impacts. We need to make sure that the data is not only inclusive, but the data is representative. And that's one of the things that I think we can't talk enough about, because that data that's the foundation of artificial intelligence is what's going to drive that impact on individuals and impact or diminish, if we can have an impact on it, the disparate impact on individuals in underserved communities. So Dr. Mazzotta, with that, I'll let you take the lead and I'll jump in as necessary, and then we'll come back and perhaps entertain some questions. So Dr. Mazzotta.
Thank you so much, Dr. White. I really appreciate that. And I'm going to get us started so we can look at some concerns that are there, and also proceed to look at what the policy landscape has looked like in the United States of America over the last few years, and then we will have a conversation on opportunities. So there are a number of concerns that are raised around use of AI and robotics and big data. And for a start, it is issues around rights and liberties. So AI is being used in the criminal justice system and in law enforcement. It's used in housing. When you apply to get a loan, there's a component of analytics of your financial status that goes into there. And then it's used in hiring, screening of applications, as has been said earlier in this conversation. And then it is also used in education. So when we think about the use in these spaces, are we incorporating and ensuring that everybody's rights are respected? Who are we leaving behind in the process of utilizing these technologies? And are we thinking specifically about individuals that are likely to be biased as a result of these applications? If it's used, for example, in law enforcement and facial recognition has to be done, what is the level of accuracy? I think a few years ago, we'd seen a number of cases where individuals were switched, somebody else is taken up for a crime that they did not commit, just because facial recognition that had been used to pair up who had done a particular crime did not get the right, they don't get the right match for who was responsible for certain crimes. And then we've also seen instances of, we've heard in the past, advocacy around issues of ensuring that these technologies are not putting certain people at risk, or are not putting certain people, making certain people not to be able to have access to services. And it seems like it's a very simple example, or something that people should, just forget about, but it is very important. A few years ago, again, there was talk of, individuals who could not get water run on a tap in a public bathroom. But when a white colleague came and placed their hands there, the tap was able to open. So AI, what have we fed into these systems? Then there are also concerns around labor and automation. This is changing the nature of employment, and working conditions are also changing. Dr. White has given us a thorough explanation of that. We've seen a self-driven truck, and we'll see that happening in the future. Trucks will be driving across the country, taking merchandise, and those are jobs that have largely been taken up by individuals in minority groups, Blacks, Latinos, and those that do not have certain level of education. When we think about bias and inclusion, there are a number of concerns there, because AI learns based on the data that they are given. So if certain classes and groups of individuals are excluded, there's absolutely nothing that those individuals can do at that point, until somebody goes back into the system and tells it to do something different, retrains it, or feeds it with new data that is inclusive. So how can we ensure that we reduce bias and inclusion when in some of these spaces, certain classes and certain groups of people are not even present, where decisions are being made, or where these innovations are being developed? And then the other issue to look at that has caused a concern has been safety and critical infrastructure. So when we think about safety and critical infrastructure, hospitals, from hospitals to the power grid, the risks that are posed by errors and blind spots increase, because if there is an error and power is not, cannot be distributed to critical infrastructure, then a lot of people's lives get to be at risk. So these are just some of the concerns that are there that we've been seeing, and that have ably been investigated by the AI Now Institute based at New York University. So continuing on concerns, we need to ask ourselves, what should policy priorities look like, in the work of evolving artificial intelligence? If we develop policies today, those policies may not be useful tomorrow, because the technological space is ever evolving. It needs for a huge and massive investment in resources and in time to constantly be looking at the AI systems, and then constantly be monitoring the policies that we have in place. It means that we need to be deliberate about doing audits of AI, robotics, and big data, and how these are impacting social outcomes for individuals, different classes of individuals. And then another concern that's being raised around artificial intelligence, big data, and robotics is around unfair advantage. Those that have access to this kind of applications are given advantage over those that do not. Not long ago, I think August, September, we saw the big scandal from the chess space, the World Chess Federation, where two individuals, one was accusing the other one of using artificial intelligence to gain advantage over the other person and win games. So if we can have AI being used and applied in certain kinds of competitions, those that have the know-how will definitely be ahead of those that do not. So it gives unfair advantage. And if we think about this and think about the question that was raised last week around countries that do not have the ability, it just throws them off completely. It disadvantages them completely in this race. And then the other concern has been, if this technology falls in wrong hands, then what happens? We don't have to go very far. We just need to think about the cryptocurrency space that we've witnessed in the last few days, all these unfolding events around FTX. How did we get to that point? So these are some of the concerns that are there around utilization of big data, AI, and robotics. And then I also want to talk briefly in view of what we are seeing as concerns and what we have looked at in terms of impacts on jobs and the workforce of the future, and how that's going to impact minority populations. I'd like to briefly consider, the latest developments that we are seeing in this space. So for a start, there is continued governmental interest across the world. And what I have here is a McKinsey extract from their report, which shows who is leading in terms of investment in this space. So if we look at technological capital, we see that it's the Nordic countries that are leading in terms of deployment of resources in that space. And then we also know in terms of what's been going on that about 60 countries have national AI strategies, and many are creating policies around this. So this is very important. It has caught government attention. One would ask, why would it have to take so long for government to come on board? Because we see in 1940s, fiction writing on robots and the rules that robots should follow. And we see in 1955 conversations around, the coining of the term artificial intelligence coming on board. And now we look after the passage of all these years, what has been happening, what has been going on. So like I have said, and I keep saying that this space is ever evolving. So each different administration that comes in is able to do what it is able to do based on the needs at that particular time. And successive administrations keep working and making headways in this regard. So briefly looking at the Obama administration, the Obama administration saw artificial intelligence as an urgent priority. Actually, towards the end of the Obama administration, they issued two very important reports, which did not get that much traction and attention because it was election time and the media's attention was directed elsewhere. So the Trump administration did a lot with regards to artificial intelligence and just this space. They launched the operating infrastructure, so to say. So the National Artificial Intelligence Initiative Office was instituted by the Trump administration. They established that. They also issued a national artificial intelligence strategy. They established first ever national AI research institutes here in the US, and they also released the world's first AI regulatory guidance, forging new international relationships and alliances around artificial intelligence. And then they also provided guidance for federal use of artificial intelligence. So they really set up what I'm calling the operating infrastructure for these technologies to be utilized in this country. And then the Biden administration has been focusing on implementation of what the previous governments have done. And also their lens has been more on looking at equity. So the Biden administration has issued a rights-based framework. Their approach is rights-based on this. And in October this year, they issued the White House blueprint for an AI Bill of Rights. So the opening statement is very interesting, and I just wanted to read it here. Among the great challenges posed to democracy today is the use of technology, data, and automated systems in ways that threaten the rights of the American public. So the AI, the blueprint of an AI Bill of Rights was issued in October, and it goes on to list a number of priorities that are in there. So I think that this is really important. I think this is the first time that we are having a sort of rights-based approach and focus on issues around equity and issues around how this is going to impact different kinds of populations. So I'm going to go through the pillars very quickly because we are looking at the policy landscape and what this really means. So the first pillar of the AI Bill of Rights is concerned with safe and effective systems. And what this means is that every individual should be protected from unsafe or ineffective systems. What does that mean in reality? So the White House says that automated systems should be developed with consultation from diverse communities, stakeholders, and domain experts to identify concerns, risks, and potential impacts of the system. So is this practical? Is it practical to have consultation with individuals from diverse communities? Those are things that have to be taken care of as this Bill of Rights is being looked at by experts, and operationalization takes place at different levels of government. The second pillar is concerned with algorithmic discrimination protections. And what the White House say is that you should not face discrimination by algorithms, and systems should be used and designed in an equitable way. So when does discrimination happen? Discrimination happens when certain groups of people are favored over other groups of people. So we've got different kinds of people, people can be favored based on their race, color, ethnicity, sex. You can be favored based on your religious orientation. Some people's religion is so easy to see when you just see them. They don't have to tell you because they have a marker on them that distinguishes them, and that clearly shows which religious group they belong to. And then discrimination can also be based on, sexual orientation, and sometimes somebody doesn't even have to say, So in view of all these different kinds of classes that we fall in, the protection that we should get here is that, algorithms should not discriminate against us based on how we look. And then it goes back to who is feeding the data in these algorithms? Who is creating the algorithms? Are the individuals creating the algorithms creating them in a manner that enforces discrimination? The third pillar that is included in the proposed in the blueprint for an AI Bill of Rights is data privacy. And it says that you should be protected from abusive data practices via built-in protections, and you should have urgency over how data about you is used. That's a very interesting one, Our phones, our gadgets, our iPads, our laptops, they come with complexities that we live every single day to try to understand. And it just feels like we're at the mercy of, these technologies right now. So how can we be protected from violations, regarding data privacy? I think there has to be deliberate measures when it comes to designing some of these applications that we use to ensure that all of us are protected as individuals. And then there has to be a place where we know where our data is being used and what it's being used for. The question that pops up on your phone, we are collecting data on ABCD, should we continue or not? If you're going to continue to collect data on me, I need to know what you're going to use it on. Because yes, I would like certain data to be collected if it's going to give me an advantage as well. But for the most part, when we give this data, we lose privacy over it. And people sell email addresses, people sell data that relates to their clients. So we need to be protected as individuals, and that's very, very important. And then the other pillar that is included in this rights-based approach is that around notice and explanation. You should know that an automated system is being used and understand how and why it contributes to outcomes that impact you. For the most part, we don't know this. We don't know when we apply for a job, for an interview, that the initial screening is being done by an automated system. And most of the times we don't know how outcomes are going to impact us as individuals. So the protections that we have right now are pointing to the fact that these are some of the things that we need to know. How practical is this? Goes back to the question on how these things are going to be operationalized. And then the last one is human alternatives, consideration, and fallback. And this particular pillar says that you should be able to opt out where appropriate and have access to a person who can quickly consider and remedy problems that you encounter. You know, there are those systems that you're into it and you're chatting with AI on the other side, and there's no person available who can help you, you know. And all these things, we clearly see that they are all tied to labor. It's human beings, and they're all tied to, you know, context and geographical systems that we are in. So if I am calling, you know, to complain or to issue, you know, an alert about something at a particular time regarding to a system that I am utilizing, I may have access to a person, but I may not have access to a person, you know. So the part of opting out and the part of being able to have access to a person who can remedy some of these things quickly is something that actually offers an opportunity for deploying human capital, deploying human beings to have alternative work in these new systems that we are operating in. So the last slide that I took off very quickly talks about love me or leave me. I sort of, you know, love me, hate me, I'm here to stay. I really liked this when I saw it, when I was doing research, and I've been having this conversation for a while with Dr. White. I was like, wait, you know, this is an inescapable future that we're living in. Nobody's going to run away. You know, we have to ensure that when policies are being implemented, first, when policies are being developed, we're there at the table. And we have to make sure that as they're being rolled out, as they're being audited, we have a voice and we have a say in all of this. So AI, big data, robotics are here to stay. And we just have to love them. We have to love them, and we have to have spaces like this where we can have these conversations and hold consideration so that we don't leave anyone behind. Because this is not a science project. This is our reality now going forward. So I will end here.
Wow. Thank you for that information. I'm definitely sitting here writing notes. And I think we did speak a lot about this on our last session, but you've done a lot more to present, which is incredible. So thank you, Dr. White and Dr. Musada. I am going to just dive in with a few questions that we had. And then after that, maybe open it up to some of our participants who I'm sure have great questions as well. So just to prepare our participants, have your questions ready in case we don't answer them through my discussion. I've had some that I've written out here. I know that we were talking about before. I think I'm going to kind of categorize them in two buckets: policy and actual, the AI itself. We talked about the actual regions, like how, I mean, I can't describe, there's not winners and losers, I guess, right? From the policy perspective, do you think, or do you find the opportunity for minorities, communities that will be affected from the jobscape, will have the opportunity to be on part of the policy side? I know you touched base a little bit about that, but how can we engage and start those conversations? Is that a local thing that we can do in our cities, or how does that give us the opportunity to engage from that perspective, Dr. Musada?
Yeah, I think like you have alluded to in the statement or in the question, it's having a bottom-up approach. I think that's what is going to be very important going forward. How can your Chamber of Commerce, for example, you know, and you're already doing this by starting with this conversation. So how can you be looped into this, and how can you ensure that, you know, minority individuals' voices is represented? So I think it's starting bottom up. The top-down approach to policy partly is the reason where we are at where we are now. Why we did not develop the right kind of systems, why we did not come up with programming or workforce development programs that would be proactive in terms of a time like this. things were coming from up going down. But if the bottom was being included in this whole process, I think would have gotten to a point where we would have been thinking, what are the alternatives for this kind of people? You know, if a person has this level of education, how can we best support them so that even if all these different kinds of technologies are coming in, we can still utilize the skills that they have. Do you know the beauty about all of this, Veronica? I want to say the beauty, I want to say the justice in all of this. The justice in all of this is that everybody is going to be affected. So I am an accountant. Accountants are going to be affected, you know. So it's not an issue that we can escape and say, oh, it doesn't concern me. I have a degree or I have this. The conversation around the impacts of artificial intelligence, robotics, big data, and utilization of all these technologies affect everybody. So it's a conversation that we all need to be plugged in. We start bottom up, and I hope that people that are watching and listening to this, if they hear a conversation about AI, they shouldn't be saying, not in my backyard. This is not a not in my backyard kind of conversation. It's a conversation that affects everybody. So creating spaces and starting bottom up, getting individuals to be part of this is very important. Dr. White talked about education and, you know, how universities and institutions of higher education can be a big part of this. I think they have a very big role to play in this conversation going forward. I'll hand over to Dr. White.
Thank you. Actually, I have a question specific for Dr. White, but go ahead. You're on mute.
You're on mute, have it.
Technology. I said she answered that very well. So thank you for not asking me to comment on that. I can't add to it. Thank you.
But my question for you, Dr. White, is, you know, just like COVID, we realized a lot of things that came out of that, right? And other jobs that kind of saw a surge in services. Like, has there been any discovery around what people jobs are being discovered around AI that we may not have thought of that actually created another industry of some sort by AI replacing?
Well, I'm not sure we've discovered a new industry, but I think we've accelerated the use of artificial intelligence in a variety of industries. And I think that's only going to be accelerated even further as we come out of AI. I mentioned financial services, and that artificial intelligence and robotics are now working in Amazon. Certainly prior to, I think, we had this labor shortage. People just weren't going to work, didn't want to work in that environment. That's accelerating the use of AI. The same thing I mentioned, nursing, for example, the robotics in nursing. I think certainly we hadn't thought of that, but that's something that's happening, and we're not going to pull back from it. Once you discover that a machine can do this job, do it more effectively, more efficiently, and more economically, you're not going to have people saying, oh, let's go back and hire human beings. So I think that's the case that's happening right now. So yes, we didn't necessarily discover new. Well, maybe we did. We discovered that it's the Mexico example I used last week. They can use robots to, in fact, test the temperature of people coming to a hospital. I think that's a new use of robots or in automation. So yes, maybe that is a bit new. That now we can put robots on the front line. We can send robots into a burning building that has the intelligence to seek out a human being. We could always send a robot in with a camera, but now we can send a robot in that has the capacity to look for a living human being. So yes, we are, I think, doing some things now that we hadn't done before. And I think, yes, COVID has, in fact, certainly on the medical side, enhanced our ability to further use artificial intelligence for positive uses.
Yeah, I was more specifically thinking like, okay, so who's going to clean the robot, right? Like, is there a place where people can actually incorporate something where hands and physical and a person actually needs to be, that we haven't thought of, right? Is that another robot cleaning a robot? I mean, I don't know. I was thinking like maybe it's another opportunity to engage human beings.
Oh, no, you're absolutely correct. One of the things that we talk about, Dr. Mazata and I, is that the jobs of the future, that certainly programming the robots is going to be assembling the robots, servicing the robots. All of those are the jobs of the future. So yes, that's coming out. And what we're not doing, though, is training people for those jobs. And that's what we have to emphasize. I think if I could go back and simply say about that earlier question, I think one of the things we have to do is impress upon workers Don't wait until your job is eliminated to become aware of how it's going to be impacted in the future. And so workers need to now be given the opportunity. So this is where we blend education of workers and government and education policy. We need to be proactive and futuristic in understanding that we need to start doing this now.
Right. That's my next approach. I know that here locally, there's a lot of attention on workforce development, right? And people not going to college and how do they get to these entry-level jobs? So that's the jobs of the future, perhaps might be a great start to developing a workforce of the future around this with robotics and AI in mind.
Exactly. And I did say, Veronica, that some forecasts are that more jobs will be created than eliminated. So if we in fact look at the workforce of the future, and if more jobs are going to be created, if we start preparing now, we can in fact start now transitioning people to those jobs.
So are those skill sets outlined somewhere? Like, okay, so what is that, right? Is it robotic mechanics and stuff like that? Is there a special report or maybe a reference where there is an outline of the workforce of the future and what we can start training now leading into AI's, expanded growth?
We had at one point in time, all of these community colleges around the nation that were designed to train people. Those community colleges have now started training people to go to college. They've lost, I think, their mission somewhat. I think this is a good opportunity to refocus those community colleges. They used to call them technical colleges, but community college now, to really look at how can we train people these new jobs, and not so much. Certainly going to college is an aspiration that we all ought to have, but it's not necessarily the best way to prepare people for this new future. If we think about right now, if I took my computer to Best Buy, which is probably why I'm having some problems, but most of the technicians today that you find servicing computers do not have engineering degrees, they do not have computer science degrees. These are people who have, through their own or some short courses, developed skills. And I think that can be done with robotics as well. How do you service a robot? You don't have to have an engineering degree to do that. But I think there can be some short courses or long-term courses at the local level that we could train people for that.
So what a great opportunity there, like a market for us to consider.
Exactly.
I know that there's several questions I know about the winners and losers with automation. I think you guys dive into that very well with the presentation. On the policy, data, inclusive and representation. I know last session we talked about who's going to be writing these laws, who's going to be the policy changers, making sure that they're not discriminating, right? The programming of these robots, resources, and people. So where's the opportunity there for minorities to engage in that outside of running for office in the boardroom or making that conversation be heard? Is it something that it's take on your local states, or you want to kind of dive in a little bit, Dr. Musada, on that?
Yeah, I think since the guidelines were, the blueprint was just issued recently, I think we minority people have to come up, with ways and means in which we can get this conversation going. Yes, it's seeking office, but this is beyond seeking office. It is being part of conversations at the local level. I want to emphasize the local level because I believe that's where the change takes place. Guidelines may be issued from the White House, guidelines may be issued at state level, but if individuals and localities are not, being deliberate and taking on, steps to ensure that they're part of these conversations, then, it just happens like that. They just becomes, guidelines that are provided. So I think starting from the bottom, like I said earlier, can universities take a greater role in this, and can local politicians take a greater role in this, in creating spaces? There's one thing that I love about the many places and spaces where individuals can be able to plug themselves into some of these conversations. Libraries. There is a library almost everywhere in this country. So libraries could be a good space that provides an opportunity for plugging in minority individuals into programming that takes this conversation going forward. So libraries, universities, community colleges, like Dr. White said earlier, all those are spaces that need to be taken advantage of as we think about, policy and policy implications. So some of the policy recommendations may be great, but as we go on in terms of implementing them, we may realize that this doesn't really work well. So if we start having conversations and we start speaking to people that would be impacted by some of these policies, that's when we're going to know, and that's when we're going to be able to fix things in real time. So yeah.
That's
Dr.
great.
White?
Yeah, and Dr. Mazata complimented your chamber group, appropriately so. I think that's a great place to start. You've got different advocacy groups, interest groups around the country representing different groups. I think we need to try and empower and encourage these different advocacy groups to, in fact, get involved in this discussion. What you have in these advocacy groups, and this is a broad term I'm using, but the chamber is one of those, is that people who are fairly well educated but have the interest of a particular sector of society in their best interest. So I think that's a wonderful place to start. We need to pull together these national chambers of Hispanic commerce, Black chambers of commerce, and have this discussion with them, because it's going to affect the people we care about and the people we're trying to serve, both from the individual level and the business level. It's going to impact us.
Absolutely. I was going to lead with the next question about, do you think it's great for a chamber like the Black and Hispanic Chamber to maybe have a session around small businesses thinking what can go into robotics and what cannot, so that organic conversation can take some of the stigma and the fear of my business going to shut down? Or because as a business owner myself, I'm thinking, okay, well, will yoga be taught by robots, right? Or like things like that. But as a small business owner, I think that lends light and then opportunity to start engaging your thought process and long-term, like, where's your business going to go? Maybe that's a good point for our chambers, but a great reference to small little ecosystems having these conversations now.
I couldn't say it any better, Veronica. You said it well. Thank you. I think that's great.
Of course. I know a lot of the questions were something that a lot of the stuff that was based into the presentation. We talked about the sections, right? Production, sales and service, transportation, maybe the industries that are being affected. Also, the talent. I know we talked about the talents in the regions. How does the U.S. fare for that, right? Is there a specific map on how the U.S. and the states in the U.S. are implementing AI? I don't know if that data has been proven, or maybe you can touch on what states in the U.S. are actually using more of it or not. Do you have any insight on that?
The Midwest, in fact, is what was called the Rust Belt, which is being reindustrialized, is actually having an explosion of AI. Automobile industry is becoming robotics, for example. The manufacturing, that's where the heart of manufacturing has been historically, the Rust Belt. And so that's the greatest area. But if you go to New York, where you have the financial sector housed, a lot of it's happening there as well. But the job displacement has been most predominantly in the Rust Belt. And then you have it secondly in the agricultural belt as well, where you have the automation, where you used to have a lot of people who would be workers coming in. Much of that is now being done by machines. And so that's happening as well. So those two sectors, if you think back to the chart that I used when I had the natural resources, many of the migrant workers are in that natural resource area. So that area is also being affected as we automate that sector well. But the Rust Belt, automation, financial sectors, and those are geographically bound, New York, the Midwest, and then kind of the Southeast and part of California in terms of agriculture.
That makes sense. I had another question in the chat room that says, do you see childcare being impacted by AI at all?
I'm a male, so I would prefer that it not be, but the answer is yes, it will be impacted. Now the question is how and when and how will that impact be, I think. So I'll let Dr. Mazata respond to that.
Yeah, I mean, that's a very interesting one. And I need to think in real time, So childcare, I think already we're seeing, innovations in the space, babies can be monitored from remotely, all those are applications that are being used right now. Would I trust my little baby to be with a robot? That's a human question that we need to ask. And I think the answer to that is entirely dependent on the person and the context which they're in. If I have absolutely no other options, I can't get help anywhere, I will leave the baby with a robot. If I can monitor and see what is happening, I can do that. But maybe I can't, you know. So that becomes a question that's so personal now. And I really like that question. It now starts boiling down to, you know, what is it that we're able to allow as individuals in the work of all this development, and what is it that we can't allow, you know. So all sectors or industries are going to be impacted. Yes, childcare is going to be impacted, just like
Right.
mining is being impacted, just like exploring, going to space is being impacted by AI. So it's all aspects of our lives, even our own behavior, you know, the way we interact with people, everything is impacted. So yeah, so we should just expect to see more of these changes taking place, but we need to be having spaces like this where we have an ongoing conversation, you know. I like to think of it in terms of, you know, having brainstorming sessions where we look at a particular sector or industry and then think of the many different possibilities that could be there. What are the great things that we can, you know, do by utilizing AI? And what are the things that could go wrong if we utilize AI in these spaces? You know, how can we fix those things that go wrong? So it's having these conversations that help us to be projecting into the future, to be very deliberate about the specific things that we are working on and that we're trying to achieve. So lots of opportunities, challenges, yes, but it's challenges that we can overcome. We don't have to be worried. We don't have to be scared. I think the beauty of being human is that we make decisions, you know. How can we just utilize these technologies to help us to get better? I think that's what we should be aiming at doing. So if it's going to help us look after our babies better, then yes, it's going to impact, you know, childcare and
Yes, I think that when last spoke, we talked about ethics. We talked about mental health, the human touch. A lot of those things are necessarily not, I mean, we cannot get a robot to give us that, right? Like to rock a baby to sleep in your arms. Things like that, I think, are going to be a great avenue to have discovery around. Another question we have, it talks about lawyers and how it seems like that industry of law is not being affected by AI. Does this mean, you know, there could use less lawyers? How come that appears to have an advantage there? Perhaps any insight on the law, you know, jurors and law and things like that from that nature? You want to kind of chime in, Dr. White?
Yeah. Yes, I think when we say that lawyers would be in the courtroom, I think that's different from saying the industry being impacted. The legal aides would be pretty much eliminated. The clerks who do the research would be eliminated. So the profession will be drastically impacted because a computer can do a case search in a matter of seconds where a human being would take days to do. So I think it will be impacted. It's just that the actual representation in the courtroom will in fact be still perhaps be by person. Now, that's what we're forecasting. We don't know what the future holds. It may be that we will program a robot so brilliantly that robot can argue the case better than a human being. But I think for the immediate future, certainly it'll be a human being in the courtroom. So all of those people who work behind the scene for the lawyer to get him or her in the courtroom, those jobs are, I think, in serious risk of being eliminated.
Absolutely. Another question here, to Dr. Musada, how do we apply the 5 pillars into systems that develop or monitor AI for sustainable consumption, government policy, perhaps marketing from the private sector?
Yeah, I think that's a conversation to have. These are just guidelines that have been provided. In terms of operationalization, I think that remains to the states and to the different localities. It remains to the different districts or places that we belong to. So there are many applications that we can have. And I think we can't overemphasize the importance at this stage in this conversation of having a few more conversations to just brainstorm on how are we going to operationalize this. When we talk about data privacy, what does that mean for small businesses? You know, what does that mean for individuals? Because it's the individual's data that is being taken, you know. When we talk about, being protected from discrimination, what does that really mean? So operationalizing each of the 5 pillars is going to be an exciting thing. And I think, like I said, it has to start from somewhere. It starts with you, the Chamber of Commerce. It starts with the local politicians being part of these conversations. It starts with universities who are training present and future workforce. It starts with local libraries being spaces where some of these conversations can be had, so that we demystify these concepts, we demystify these technologies, and we start, thinking and planning how can we ensure that this becomes mainstream part of our lives as well.
That's a great addition to that conversation. I know before too, they talked about labor unions and stuff like that. Are there like groups, say AI groups, that are forming to kind of collectively, associations, national associations that perhaps are starting to, kind of be a little more progressive on pursuing the conversation with policy and opportunity with disadvantaged communities? Is there anything like that, do you know, that's forming now?
Okay, just realized I was muted. There's a lot that is going on in this space. Like, it's really, really exciting. It's really nice. I alluded in one of my slides to the AI Now Institute. So AI Now Institute was formed of the conversations, I think, after President Barack Obama, had been, positioning this as a very urgent matter in the country. So New York University are the ones that are hosting the AI Now Institute. I think there's a number of organizations, Responsible AI, that are trying to advance equity, social equity in the utilization of artificial intelligence. And yeah, there's a lot that is going on in this space, and there's a lot of conversations. I've been seeing a lot of conversations initiated by the government through different government groups that I belong to, but then also there's a lot that's happening within the think tank space. So I know that the Brookings Institution are going to have a conversation where they're going to be breaking down what do these 5 pillars mean and how do we operationalize that. So there's a lot that is going on in this space. There's lots of resources, and I think that's a good starting point.
Yes, there's also an international organization that just had their meeting in Ethiopia about 2 months ago. So yes, there are organizations out there that are trying to address this. What I'm not sure of, though, is the involvement, as I think Dr. Mazada pointed out, at the grassroots level by individuals, and how diverse those organizations are. When I go to meetings, I find myself in a minority in terms of the people discussing this topic. That's unfortunate, because whether we like it or not, as we've emphasized, I think from the very beginning, it's going to impact us. And we need to be out there influencing the policy, generating the data, training people to build the robots and program the robots and service the robots. We need to be involved at every level in a multifaceted way.
That's great. I'm thinking these conversations and sessions like this will hopefully entice people to get involved and sort of have an interest in that. I think this concludes our time. I do want to allow some closing remarks, perhaps from Dr. Mazada or Dr. White, that you want to leave behind for our participants before we close out our session.
Dr. Mazada.
Yeah, this has really been a very exciting conversation that we've had first and this second part. I've taken part in conversations like this with Dr. White elsewhere, but we haven't had this much of, back and forth conversations like we have had in this one, so I would really like to thank the university and also the Chamber of Commerce for taking this initiative. I think you're setting the bar high to, challenge others to think of holding such kinds of conversations. So I've learned a lot other than giving, the status of, what does a policy landscape look like? How does it look like? And other than defining these terms and saying that there's a lot that is going on in this space and just looking at, the impact on minority populations. I think I have, I'm carrying with me, the goal or the desire to speak a little bit more about this and to sort of, work around demystifying, issues around AI and robotics and big data. And I'm so happy and honored that I've been a part of this conversation. And I hope that we can go on and create those, spaces and create those, future thinking, teams or clubs or whatever we want to call them, little labs where we start looking at sector by sector and look at these 5 pillars that have been issued as a guideline and see how can we implement these and how are these going to impact us. If these kinds of impacts come up, how are we going to overcome our challenges that come with that? So I think it's up to each one of us to continue on with this conversation going forward. I'll leave it to Dr. White.
Well, let me say thank you. It's been a pleasure. I want to thank Dr. Mazzotta. The history is that sometimes the mentee becomes the mentor. She came to me as a partner in a mentoring program and learned that we have so many things in common and both have this interest in this topic. And I've been learning from her ever since, and both globally and both in terms of the specific work she's doing. So I want to thank you, Dr. Mazzotta, for you're the future. So I'm a professor emeritus and you're assistant professor. I'm going to try and make sure that your voice is heard, and I'm going to support that voice. But also I want to thank the Institute. I want to take Dr. James. He knows how much I think of him and the Institute, the work you're doing. I want to thank the 2 chambers. That you have the foresight to, in fact, have this kind of discussion speaks well. I'm not as dismayed as I would have been otherwise than the fact that you're hosting this and participating in it. It says to me that there are people out there like yourselves who know that this is something that's going to affect our lives, and I think you're prepared to try and engage in trying to influence that, in fact, impacts us in a very positive way. And so I just want to thank you for that and look forward to any other opportunities to engage and support and work with you in the future. So thank you.
Well, thank you both. That concludes our session today. I hope everyone has enjoyed the conversation and has taken a lot of information out to implement and use in the circles that you're in. Thank you, and T. Dallas. And I guess we're done with our program.
Wow.
Thank you for joining us.
Thank you.